I would like to review some after-surgery instructions if you had breast reconstruction with either a tissue expander or an implant. So first we'll start with medications. If you had a mastectomy, you will be admitted overnight in the hospital. You can either stay 1 or 2 nights, and I would say it's probably 50-50. Half of women stay 1 night, half of women stay 2 nights. It all depends on your comfort level and how you feel. Some women want to go home the first day after surgery because they're much more comfortable at home and they don't have the nurses kind of checking on them every 4 hours. Some people have a hectic life at home, or they're just not comfortable enough, so they stay 2 nights in the hospital. So depending on which medication works for you in terms of pain control, we'll give you a prescription to go home with that pain medicine. We also give you a prescription for Valium, which helps relax the muscle, because we usually do breast reconstruction with a tissue expander or an implant partially underneath the muscle, and sometimes that muscle can spasm a little bit and you can feel that, and Valium definitely helps with that spasm and that feeling of tightness. So if you have any nausea, we'll also send you home with a nausea medication. We keep everybody on antibiotics for at least a few weeks after surgery, and that's because the drains are in place after surgery, and anytime that there's a drain in place, it's a potential for contamination from the outside world where there's bacteria along the drain to the inside world where there's the implant. We also recommend that you get an over-the-counter stool softener from the pharmacy, either Colace or Centra. Those are good ones to start with, because taking a narcotic pain medicine can definitely make you constipated after surgery, and we don't want you constipated and we don't want you straining to have a bowel movement. Very few people need to apply what is called nitroglycerin ointment to their breasts. Sometimes if the mastectomy is very thin, we want to increase as much blood flow to it as possible. And so I have you apply some ointment onto your breast, usually for just a few days after surgery. I start this in the hospital, so it would not be new to you, and I would give you further instructions on how to perform that. I still want you to avoid any aspirin, Advil, Motrin, and Aleve for about 1 to 2 weeks after surgery. And this is because those are blood thinners. They're known as NSAIDs, and they can increase your risk of bruising or bleeding. The drains, we have another instructional video on how to empty the drains and how to care for them, so refer to that for drain care. You will want to call my office or the breast surgeon's office if you have any problems that are severe. Incredible pain, trouble breathing, chest pain, shortness of breath, leg swelling, high fever, chills. Any of those things would be of concern, and you would definitely want to call me. And if you can't get a hold of me, then go to the nearest emergency room. After breast surgery, it's very important to get out of bed and walk around. You really cannot lay in bed for a full day or even hours long unless you're sleeping in bed. And that's because immobility, especially in the setting of a longer surgery and breast cancer, can lead to forming a clot known as a DVT, or a deep venous thrombosis in your leg. If that happens, that can be very dangerous. It can go to your lungs. So we actually give you a little shot of heparin while you're in the hospital during your stay. That helps prevent it. We put compression stockings on your leg, which squeeze and pump the blood through the rest of your body. But when you get home, it's really up to you to be able to walk around and move around and pump that blood out of your legs on your own. So for most surgeries, you can remove the gauze after 2 days, and you can shower at that time. When you shower, you can use the neck lanyard that I'll show you in the JP drain instruction video, and you put that around your neck, you pin the drains to it, and then you mostly want to shower with your back toward the water. And you can wash your hair, and then you can get some soapy water on your breasts and then just pad them dry at the end, but you don't want to take any baths or go swimming and soak any of the incisions. If you had what we call a free nipple graft, where the nipple was completely detached and put back on, that's a separate surgery, and I would go into that further, but for that specific surgery, you can't get your breast wet for 2 weeks after surgery, and you do need to take sponge baths for the rest of your body. If we put you in a surgical bra, we'll have you wear that until your first post-operative appointment when you come see me in the office. You can wash the bra and keep it clean. You don't have to wear the bra at all times. If it's either uncomfortable, too tight, the Velcro is bothering you, you can definitely remove it. So unless you had free nipple grafts, you can shower 48 hours after surgery. You do want to avoid touching your breasts because everyone has bacteria on their skin, especially underneath their nails. You don't want to be rubbing your breasts, pushing on your breasts, because that can first of all move the implants or rotate the implants, and also it's a risk of infection. You want to wash your hands as much as possible, especially after you use the bathroom, because that's going to lower the risk of infection. If you do have drains, which everyone pretty much does after breast surgery, I will put what's called a bio patch, which is a chlorhexidine impregnated patch which goes around the drain exit site. That will be covered with a clear dressing underneath the armpit. That should stay in place. Those patches last for 1 week, and they release an antibacterial fluid which decreases the chance of bacteria flowing in along the drain to where the implant or the tissue expander is. Mild swelling and bruising is completely normal. There's risk to the surgery, which we will review at the time of your preoperative appointment. If anything out of the ordinary, or if you just don't know, of course, give our office a call. You'll also want to avoid all forms of nicotine, whether that's smoking, secondhand smoke, tobacco of any sort, including chewing tobacco. You will want to avoid that for 1 month after surgery because that really delays healing and can increase the risk of some of the skin dying or even infection.